Are you ready?
I sure hope so.
Okay, I'm sure you are. Good afternoon, everybody. Another wonderful crowd here today on this beautiful day here. I'm happy to introduce Doctors Rojas and Smith here from MCR Chiropractic. They are here. They're going to tell us how to end all of our back pain because it looks like lots of people have back pain. All right. You have a lot to live up to. Okay.
Good afternoon, everybody. We're about to get started here, and I'm going to basically turn it over to Dr. Rojas here. She is much easier to look at than I am, so we'll just start with that. But what I say, I passed out some exercises. They're basically our first level kind of basic exercises or stretches you can do pretty much each day. I will say that if you do try them and there is some discomfort, don't try and work through it. We want you to be able to be comfortable during these. Might be a good reason to reach out why they're uncomfortable. We didn't quite get copies for everybody, but we can get some more to you if you didn't get one, so just please let us know. Dr. Rojas is going to go through some great information today, a little bit of background, kind of get into some meat potatoes, some things for you guys to do. If any of you have any questions or want to do a follow-up, a quick 15-minute free phone consultation, et cetera, I'll be over here at the end. I can just take your name and your number down, and Dr. Rojas will reach out to you and find a time that works for that, okay? So anyway, I'm going to pass it off to her.
Thank you so much. Thank you so much for having me here. I have heard nothing but amazing things from the Council of Aging over in Walpole. I hear that you guys are the best Council of Aging in this area. I see some agreements. Absolutely. So thank you so much for having us here. Like Dr. Smith said, my name is Dr. Maggie Rojas, although if you do come by our office, you'll often hear Dr. Maggie around. So if you do hear that, I am that same person. So I am here to present to you and talk to you guys about low back pain. Just so that I can get an idea, who here, show of hands, have experienced low back pain in the past? Fair enough. How about anyone here or a family member or a close friend who currently is experiencing some form of back pain? Not awesome that you have it. Sorry to hear that. But awesome that you're here and you're taking an action step to learn more about it. I think that's the first step to really get in control of what's going on with your body, is to know what is going on with your body. So to begin, I want to just briefly recap on what is low back pain. It is defined as a pain felt in the spine, whether it can start at the neck or down to the lower back. It can range from dull pain, sharp pain, sometimes stabbing pain, and it can be something acute where it started last week, or something chronic that started more than 3 months ago or for several years. Now, the World Health Organization has classified low back pain as the #1 cause of disability in our nation, unfortunately. It's the #1 reason why most folks are not able to continue to work or continue daily activities with their families or loved ones, or any form of activities that they enjoy to do. Now, a couple of questions, and please do not feel bad if you got these questions wrong, or feel great if you get some of these questions right. This is just for fun, because I like to have fun sometimes. What is the most common cause of low back pain? Does anyone have a guess? You can say a letter, you can say a number. C, I heard a C. B, A, wonderful. Pregnancy, definitely. So if I had to choose one, if I only had to choose one, for the record, you are all correct. All of these can be contributing to your back pain. If I had to choose one, if you said B, thumbs up to you. That is probably one of the most common factors that will cause low back pain. Pregnancy can lead to poor posture. Different changes with cancer, different changes with stress can lead to poor posture. Sports or work injuries can lead to poor posture. Unfortunately, that is one of the leading causes there. Now, what is the most common symptom of back problems? Any thought? You can yell out a letter. A, sciatica. Great. Any other thought? C. All right, it sounds like C is kind of a consensus answer. Great job. That's great. Unfortunately, symptoms is what we feel. Sciatica, you're not wrong, but sciatica is more of a condition of what is already happening to you. The stiffness, reduced mobility, that tends to be the number one thing that I always hear from patients of what brings you in to begin with. One more question. Does anybody know what parts of the body is involved with back pain? We have an A. Maybe muscle. I hear an all of them. I hear a B. Great job. There's no wrong answer here. All of them can be part of it. Now, when we talk about low back pain, I like to categorize them in 4 major groups. We'll talk about these 4 groups in a moment, but typically low back pain comes from these 4 areas: the discs, the nerves, the joints, or the muscles. Sometimes it's a combination of 2 or 3. Sometimes it's all of them. Your doctor's job, my job, is to figure out which one of the 4 is the main component. And if there is a multitude of components, which one is presenting the most? And more importantly, is there something that we can do about it? So, symptoms. Symptoms that kind of contribute to low back pain that we are all familiar with. We have pain, tightness, range of motion, difficulty lifting your arm all the way, maybe difficulty just lifting your head up to look at your tall grandson who's grown into a tree, stiffness, sometimes leg pain. We have some swelling, some burning, or even some numbness, some lack of sensation. Now, a little bit of anatomy here. We've talked about the joints, the muscles, the discs, and the nerves. Speaking of just the bones here, if you have never seen this before, I'm really sorry. You're going to see it now. So looking at the spine, our spine is divided by a multitude of bones, discs, joints, nerves, and muscles. They work together to structurally keep you supported. They protect your spinal cord, and the spinal cord is that main highway that connects your brain to the rest of your body. If there is dysfunction of this joint, if there is dysfunction of the bones themselves, the discs themselves, that communication between the brain and the body becomes disrupted. Now, just looking at it from here, I know that arthritis is a buzzword often thrown around. What is arthritis? Quite literally, it's inflammation of the bones themselves. What that means is that the shapes of the bones themselves change a little bit. And when that occurs, mechanically, the way that you move is no longer the same way as it was before. Great news is there are things you can do to prevent it. Unfortunately, once it's there to stay. The better news is that even if you have it, there are still some things that you can do about it, which I think is fantastic. Nerve supply, like I mentioned, the nerves is the most important player to keep information from your brain to your body. If we're unable to communicate to our hand, okay, pick my coffee cup up, then we're just not going to be happy enjoying our coffee in the morning. It's really important to make sure that we get a lot of feedback information to our nerves so that we can continue to do everything else. Now, I'm speaking mostly of big motions, right? Picking up your grandson, granddaughter, picking up some flowers from the ground. But another really important nerve function that I don't want us to forget about is digestion, your heart regulation, anything related to your lung regulation. All of these major organ systems are also regulated by our nerves. And so if we are not able to supply good information to our nerves, it's very possible that these same organ systems can be affected negatively. A little bit more about that soon enough. Lastly, disc herniation. If you or somebody you know hurt your low back, who is this on the front side of your mind or loved one's mind? Yay, nay, thumbs up, thumbs down. I saw some thumbs up. Wonderful. I would say this is probably the scariest thing that could happen. What I'm happy to tell you about is that it's really not that scary. Oftentimes when there is I have a little model here, and if you would like for me to show you closer up, I'm more than happy to show you. When there is a motion to the spine that results in the discs to work harder than what they need to, you'll get a little pop. Does everyone see that little red bubble there? This is what's considered a full-blown disc herniation. What happens here is that a piece of that disc itself is lodging against the nerve and lodging against the area of the spine. That's typically a big cause of a lot of low back pain. It is actually relatively rare for that to happen. What more likely happens is that there's a little bubble that goes through it. However, even if it's a small bubble that pops out through the disc, you can still have the same experiences as a full herniation. The great thing about this is that for the most part, there's always exceptions, but for the most part, this will heal with time, with certain treatment modalities. There's ways that you can heal from that. On more severe cases, there are other treatment options that are available, which we will talk about absolutely. But this is the scary disc herniation that everyone's afraid of. I don't want you to be afraid of it because your discs are meant to help your body move. That's what they're meant to do. Just sometimes they work too well. Any questions about the discs? Okay. So back pain doesn't just happen. It usually never is I woke up today, although it might feel like it. I woke up today and my back pain started to hurt. Typically, there is a cascade of events. Something happens, a problem happens. That problem will cause an effect in your body. It'll affect those discs, those nerves, the joints, or those muscles. And when those areas are affected, that's what results in the stiffness, the lack of range of motion, the sharp pain or the achy pain, and so forth. The problem that usually comes that starts everything, I like to classify those as the 3 T's. Typically trauma, typically toxins, and sometimes our thoughts. Traumas, as you can imagine, I like to consider them as macro versus micro. Macro being, knock on wood, you fell down, right? A big traumatic event that happened. Maybe you were shoveling snow, or maybe you were weeding in the garden and you just pulled a little bit too hard and you fell back a bit, right? We're all familiar with those big related traumas. Micro traumas are the ones that we don't think about much. Those are our posture. If you're on your phone and you're sitting slouched for a long period of time and then you get up and you're like, oh, my neck is achy. I know, I've been there too. So micro traumas will still affect the joints of our spine, will still affect the joints of our low back, especially how you're sitting down over a long period of time. Now, with those, so that's the trauma. I mentioned toxins. Can anyone give me an example of a toxin that you think? No wrong answers. Drugs. Oof. I hope you enjoyed the seesaw time, though. So if you didn't hear, we had drugs here. Going on a seesaw with a grandchild, that is definitely traumatic. Drugs is a really, really important toxin. Also, smoking will also affect the health of your joints and your muscles. Alcohol, unfortunately, will dehydrate us and affect our livers. Even lack of sleep will not allow our bodies to rest and recover as we need to. All of these toxins will still affect our body system. The last T is our thoughts. I like to think of them as stress. Most of the time, let's say a common stressor being finances, right? Worried about, okay, well, how am I going to buy a birthday gift for my 7th grandchild, or whatever the case may be. These stresses will, or if you have a heated conversation with a friend or a loved one and you can feel your shoulders tensing up and you can feel like you're sweating more because you're just in a very heated debate with someone, this level of stress still activates your muscular system, still activates the nerves in the same way as if you were to fight off a tiger. Your body, as much as we've come such a long way, is still kind of not all there, in the sense that your body sees as stress as any other type of stress, whether you're playing baseball in the major leagues or you're just having a very heated debate with someone that you love, your body still reacts in that same way. And that stress will tighten your muscles, tighten the joints, not allow you to move in the best way that you can move. Thank you for listening to my tangent about the 3 T's there. Once a problem happens, that's when the joints, the discs, the nerves, the muscles, those get affected. And once that gets affected, that's when we start to have pain. So we talked about stress, just visually here, thoughts, toxins, and traumas. We talked about the macro traumas, car accidents, shoveling snow, micro traumas being the repetitive actions, sometimes your posture, sometimes the way that we're texting or we're trying to read a book or crocheting, because I know I've done that too, and I've had to stand up and I'm like, whew, my neck. Sitting, I believe it was 5 years ago, don't quote me on that, but 5 years ago, the health organization classified sitting as the new smoking. Does anyone wonder why? Yes, ma'am. It's a very strong statement. You're right. It's a very strong statement. Does anyone have a thought why it's such a strong statement?
Well, it cuts back from your exercise. You're not moving.
If you didn't hear,
Clots.
wonderful young lady said that it. You're welcome. Wonderful young lady here said that sitting, if you're not moving, you're not activating any muscles or joints, and you may be developing clots in your legs. And then one more thought. Yes, ma'am.
That's kind of what I was going to say. Yeah.
A reiteration. Absolutely. It is a strong statement. And the reason why it's such a strong statement is that exactly. Because if we're not utilizing muscles of our legs, muscles of our back, there are other health conditions that can also occur with that too.
To expand on your point on how severe it is, it just has, as Dr. Rojas was saying, such a multi-level effect on our health, on our different health systems.
Yeah.
So obviously the lack of exercise, sustained sitting, the lack of cardiovascular health that we get if we sit for too long is one thing. When we are sitting for long periods of time, it has such a detrimental effect on our posture. We actually start to almost degrade a bit of the nervous pathways that we have from the brain to the body. So it then starts to affect our ability to have good coordination and balance. We all know that as we get older, that's something we need to be really concerned about. So those are the two things. Outside of the fact that it is really hard on the actual structures of the spine, which then again lead to further debilitating conditions that again allow us that when we're not sitting, not be able to perform our exercise at the level we'd like to, keep those good neural pathways functioning the way that we want them to do, which leads us predisposed to having falls, et cetera, et cetera. That was the reason for them really putting a stamp behind it, because it's something we do every day and we don't think about it. And then especially with all the remote work and everything at home, people just sit at their desks all day long.
Well, the couch.
That's kind of it.
The couch
Yeah.
potato.
Yeah.
Yes, sir.
I'm good to say, I think it's interesting that the Apple Watch has you get up every
I got
hour for several minutes for about 12 hours a day.
Yeah.
If you didn't hear, the kind gentleman in the back said that your Apple Watch, if you have one, will give you a reminder that you're sitting for too long to stand up and move around. A lot of the current research that's been published in the past 5 to 10 years have supported that even 10 minutes of any physical activity, whether it's walking, spending time outside, walking is a big one, whether it's 10 minutes stretching, even 10 minutes of meditation will affect the system in such a positive way that when comparing a population that does not do that compared to a population that only takes 10 minutes to go for a walk, they've noted significant health benefits from adding even just 10 minutes of physical activity. So I agree with you. It is a strong statement, but to also be clear, it is not suggesting that at this very moment, sitting down is the equivalence of smoking. It's the thought of sitting for the entirety of the day and to have no motion whatsoever in your spine is the equivalence of lack of health. I love the question. Thank you so much for asking. And we talked about thoughts and stress and how that can be a contributor to our body system as well. Now, specifically as chiropractors, I would say the number one issue, the number one problem that we treat are joint dysfunctions, and they're also known as subluxations. These joint dysfunctions are categorized by several different components of the spine. Most commonly, they're known as joint misalignments. Now, to also be clear, when we speak of misalignments, we're not referring to like dislocations of the spine where there is a significant misalignment. That's a different form of misalignment. Soft tissue damage, inflammation to the joint or nerve irritation, as well as muscle spasm and pain, loss of inhibition, which essentially stands for the lack of nerve information being sent from that joint, and most commonly a joint fixation. All of these here categorize as your joint is not moving as well as it should be. Typically, it's more common for certain areas of the spine to have that additional stress that allows it not to move. One thing that I think is absolutely beautiful is that there are specific patterns to your spine of moving a lot and being stable. For example, your rib cage. Your rib cage wants to be stable to protect your heart, protect your lungs. Your neck loves to be mobile and move all around. So oftentimes the number one thing that happens is that your neck doesn't become mobile. And now all of a sudden you lose that mobility. Maybe your upper back is going to try to compensate for the lack of motion of your neck. You know, if you're driving and you can't turn your head to look at your blind spot, you might be moving your whole shoulder, moving the entire body, right? So your body is going to compensate for what it doesn't have. When your body is doing things that it is not supposed to do, it's going to create dysfunction with it. And that's what we look to correct. We've talked about nerve supply. We've talked about nerve. Now, I want to just skip a few slides because I want to make sure that I can at least tell you about benefits of movement and also benefits of physical therapy, chiropractic care, about taking control of your health as well. So my question in general here is, if you have low back pain, what are some things that you do? No wrong answers.
Exercise like before you get on the bed, before you get up.
I love it. Some exercise before bed.
Take 2 Naproxen.
Take some medication. Okay, understandable. Yes, ma'am. Absolutely super important. Stretching. Also, in case you didn't hear in the back, the young lady in the back said changing her shoes, especially if she's worn them a lot or if the wear pattern is worn down. Absolutely. One more. Yes, ma'am. Ice. Absolutely. Some ice. Absolutely. So a lot of what I hear is symptom control. Now, symptom control is, I just need to feel better right now. Maybe it's an over-the-counter medication. Maybe it's just resting. Maybe just some ice. Working through it, not my favorite thing to do. But also more long-term correcting is changing your shoes, changing things that will also affect the back. Sometimes we do one of these, sometimes we do all of them. Now, historically, when we talk about the medical community, I want to be clear that I'm only speaking about chiropractic. Now, in the traditional medical community, common answers that you'll receive from doctors are Put some heat, put some ice, and rest. Maybe some drug medications will help. Steroid injections, pain management, surgery, physical therapy, chiropractic care, or alternative care. That might look like acupuncture, maybe massage therapy, or something else in the middle. Now, drugs specifically, just to be clear here, I am not team anti-drug here. They have their place in our community. If you want to have a conversation about what drugs you should be taking, please, please, please contact your primary care, contact your prescribing doctor to have that information with them. However, I do want to share a fun fact with you. Has everyone heard about the opioid crisis in the United States? Okay. I'm going to tell you a very bone-chilling fact. 98% of the world's opioid supply, so 98% of the world's supply of opioids are consumed in the United States, which means that the rest of the world only consumes about 2%. I am not here to talk about why that is the way it is. However, use that information what you will. Unfortunately, we have developed a healthcare system of quick fix. We have developed a healthcare system of take this and don't worry about it anymore. Unfortunately, quick fixes is not going to change the root cause. Does anyone remember the 3 T's? Toxins, trauma, and thoughts. Correct. Medications, unfortunately, they're not going to change your stress levels. Unfortunately, they might change how your joints are healing, so maybe there is some effect with trauma specifically, but unfortunately, it might not significantly help with toxins. So again, please this is not a recommendation of stop taking medications. Please have a conversation with your prescribing doctor to see what is the plan for you and if you are on a good route. If you would like to share with me your specific information to receive a more personal advice, more than happy to speak to you separately, okay? Surgery is another very common low back pain. A little fun fact about myself that I did not mention earlier. So I had low back pain as a child, as many of you, and my parents did not know of the benefits of physical therapy or chiropractic. So I would complain of back pain when I would do chores around the house. My brother thought it was very convenient, and he did not like that. But my parents were very great parents and said, let's go to the doctor's office and just make sure everything is fine, because a 10-year-old shouldn't be having low back pain. And they found that I had scoliosis, which, if you don't know scoliosis, it's a curvature of your spine that is a little bit abnormal. I am very lucky that, now in terms of the severity of scoliosis, it can be very severe to the point where you have no function of your internal organs because of the way that your spine warps. And in mild cases, no effects whatsoever. I was very fortunate to be somewhere in the middle. My parents chose the surgical route for me, so I had surgery for my back. Again, my personal story here, it did not fix my low back pain. I was great for many years, and then I would go to high school and I would play sports and I would do a lot of physical activity. I would go hiking with my family and I would still have neck pain and I would still have low back pain. So my brother said to me, I think you should see a chiropractor. Maybe there is something that they can do something to help you with your back pain. And I was very fortunate that I had a great team of chiros, physical therapists, even massage therapy, that they've taught me how to manage my back pain in a way that I did not need to rely on medication. So even if you go through the surgical route, I want to just give you a beacon of hope of all hope is not lost either. Maybe there is something that can be done to help you manage your day-to-day pains as well. Now, surgery specifically, There are several different types of surgeries available. I am not a surgeon, so if there are specific questions about what is a laminectomy versus what is a fusion surgery, I'm more than happy to share knowledge about that. But surgery is one option. Typically, most orthopedic doctors will not jump to surgery nowadays. They typically like to start with conservative care. It's where I like to start as well. Conservative care means non-pharmaceutical and non-surgical. So if you are looking for conservative care, that's what that means. Non-pharmaceutical, non-surgical. From there, imaging may be taken. Again, very case dependent. Interventional care will occur, and if everything fails, absolutely everything fails, then your surgeon might look more into surgery for your case. Again, this is more of a traditional medical route. We talked about the different types of conservative care being chiropractic, physical therapy, massage therapy, biofeedback treatment, which is stimulating the nerves and getting information to and from the nerves, as well as acupuncture, and someone mentioned it earlier, exercise, as well as diet, making sure that we're feeding our body good, nutritious foods. Absolutely. And last, most importantly, stress management. Again, research states that if you spend 10 minutes on just meditation, whatever meditation looks like for you, it does a lot to reduce overall stress levels, helps regulate normal hormone levels and natural chemicals within your body as well. Lastly, out of the audience here, is anyone familiar about chiropractic care? I know there's a number of folks here. Beautiful, wonderful. Can I have maybe like one or two thoughts of what is chiropractic care or what chiropractors do? Yes, ma'am.
Keep the body in alignment so that you can move without pain.
A great answer.
Lessen pain.
Great answer.
I had a hip that I worked with a chiropractor for 7 years until I retired before I could have it done. He
Yeah.
saved my life.
I'm so glad. If you didn't hear, young lady in the front said that chiropractors help keep the alignment of the spine, helps keep motion in the spine, and helps joint moves. You are 99% spot on. The only thing I would add is that we introduce normal motion to the spine. That's the number one thing that we do. If you've seen videos or if you've been to a chiropractor's office, the number one fear that I get is, you're not going to twist me, are you? I'm not ready to be twisted. I hear that all the time, and I'm here to tell you, we don't always twist all the time. The goal is to create motion in the spine, and there are several ways that we can do that, introducing gentle joint mobilization. Especially as we get older, more complication happens to our health, or maybe we have osteoporosis, osteopenia, maybe there are arthritic changes going on, maybe you did have surgery in the past. So a chiropractic treatment is not a one-size-fits-all. Your chiropractor will take different measures to what works best for you and your body. Absolutely.
Is a chiropractor the same as a physical therapist, or are they different?
Very close. I like to call them sisters or brothers. And the reason why I say that is because there is a lot of similarities within chiropractors and physical therapists where, and again, each condition is a little bit different. For example, if you had shoulder surgery, you would want to go to physical therapy first to rehab the shoulder. So that's one example. However, treatment style can be similar in the name of exercises, breaking bad posture, and creating some motion in the joints or motions in the spine. Physical therapists will do the same with their own special twist, something slightly different, as well as chiropractors. We do the same, also slightly different in a different manner as well. Is that an okay clarification? Okay. Any other?
Yeah, we actually think that the two of them work very, very well together. That is kind of what all of our clinics are based off of, because we have both chiropractic and physical therapy there. there is a lot of similarity in the different things they do. We do little things a little stronger than they do things a little stronger than we do, and it kind of fills in the gap, so to speak, when it comes to musculoskeletal care, specifically to the spine. So they are similar, but there's a little bit of difference. Together, I think a lot of times it actually gives you the best well-rounded chance of getting back to your 100% functionality.
And to add to that, I think your individual goals matter too. If there are certain goals that you have that as a chiropractor, you know what, we cannot reach those goals, we might say, I think it's time to team up with physical therapy to help you get to the next step, or vice versa. Yep, or vice versa, where the physical therapist might say, you know what, I think it's time for you to start seeing the chiropractor to get to that next step too. Absolutely. I'm just going to skip here for the sake of time. We've talked about the three, we call it the three-legged stool, just the three main components of treatment, which are the adjustments or the joint mobilizations, breaking bad habits, that educational component of, and that looks very different for everyone because we all have different needs, as well as stretches and exercise to maintain that good mobility that's now introduced to your spine, or to prevent it from the future. One thing I do want to mention before we conclude is care and treatment. Now, treatment is typically separated into three portions. I like to classify them in two portions. The first one I call palliative care, or feel better care. We want to feel good. The second portion is corrective care. Oftentimes they get mixed up, where once we feel better, we think the problem is gone and we are back to normal. And oftentimes, if we don't keep up with stretches, we don't keep up with breaking our bad habits, the problem is going to start again, which is why after the feel good, I feel much better phase ends, I like to, again, everyone's a little bit different. We like to move towards a corrective phase to just make sure that these benefits are more long lasting than a short-term relief. So I'm just going to skip through.
Maggie?
Yes.
Before you,
Sure.
Can you go back to the slide, one more, right here. This slide here that we kind of skipped over for time, one thing I do want to mention is whether it's to an orthopedic surgeon or whether it's a chiropractor or a physical therapist, the consultation part of it is really one of the most important aspects. Your current past health history is really important, so you want to make sure that you're getting a good quality listener in that provider for you, so they're hearing sort of every aspect that has formulated the reason of why you're there. The other aspect on here is the goals for care. And I know a lot of people kind of think their goals for care is just to feel better. That is usually everyone's immediate goal, and the palliative care that Dr. Rojas talked about. But the goals for care are really important. We kind of chunk them down into sort of that palliative care, that immediate care, like I want to feel a little bit better soon, like as in before I even got in the office. The next two phases are what we call like the have to do care, like what's our have to do goals. All right, so I want to feel a little better, yes, but I also have to be able to, drive 30 minutes to work every day without having back pain, because I have to go to work every day. That's the have to do goal. That's kind of where we start. We talk about that sort of pain relief and corrective. And the next is the want to do goals. And those are your more long term. So if you can feel better and you can drive into work without having any pain or be comfortable at work, maybe you can get back to playing tennis or get back to golfing or get back to exercise. So wherever you go for your care, make sure that these two things are, there's some quality time spent on that, because that should really shape the foundation of where your direction of care should go. I know we do that. I know Bay State does that as well. I know a lot of the quality care providers do. But whether you come and see us if you have some issues or someone else, make sure that you go in well prepared with those, because really that's gonna help you to get really what you want and the most out of the care that you get. So,
Thank you.
sorry.
No, thank you. Any other questions so far? Yes, sir.
How do you move from that first step up? What are the triggers that you move from that first step to imaging?
I'm almost there. At least I think so.
I think you went past it.
I passed it. Just kidding. There we go.
From conservative care to imaging?
Everything is case to case. I strongly dislike giving that answer, but it is unfortunately case to case dependent. What I mean by that is if you came to an office of a provider and said nothing but I have low back pain, there isn't sufficient clinical evidence to warrant, okay, maybe we should get some imaging. Granted, certain case history, maybe age, past history of trauma, maybe there was a fall, certain clinical indications will say, you know what, let's get imaging done sooner rather than later because there are certain clinical findings that are too abundantly clear that we cannot ignore. Would you like to chime in something else there?
Yeah, I mean,
Yeah.
the other is we set milestones, timing milestones. So, you know, we're going to start with this course of care, whether it's for 2 weeks or for 4 weeks. And if we don't see X amount of improvement, we move on to the next stage. So whether it's chiropractic or physical therapy care, the two most common methods of conservative care, everything is done on a timeline basis. So we want to be able to make sure we hit that benchmark. And if we're not, we need more information, imaging, or whether it's a blood test or whatever it is the next step.
Yeah, absolutely. Any other questions? Yes, ma'am.
Can you help like a past severe spinal fracture that's healed?
Depends. So once a fracture occurs and once it's fully healed, there are things that we can do to introduce normal motion into the spine. Can we fix completely perfect 100%? I don't know. But can we get back and focusing on your goals in terms of short-term, immediate, and more long-term of what you want to do? Absolutely. Absolutely.
Go into osteoporosis. I mean, is there a danger there where the whole spine is weak of manipulating it? Or
Yeah, absolutely. So if you didn't hear the question was, is there a danger in doing the adjustments on a already weakened spine or a spine that is at risk for fractures or has osteoporosis, osteopenia? The answer to that is absolutely. There is that very real risk that a fracture could occur. Part of the initial consultation and part of the getting the full case history is to create a treatment plan that makes sense for that person. So an adjustment done on a 17-year-old who is a star athlete may look different than 70 years old with osteoporosis and a history of fractures. Those two level of adjustments are not completely comparable. There are different modalities and different ways to adjust the spine to keep that in mind and keep risk of fractures very low. Absolutely. Yes.
What about spinal stenosis?
The question is spinal stenosis. I love this question. If chiropractors can help with spinal stenosis. In case you don't know or are unfamiliar, spinal stenosis means that certain areas of the spine where there's some really beautiful holes or region, these holes or regions allow where the nerves can come out through or where the spinal cord can pass through, right? That highway that we've talked about. The stenosis means narrowing. And typically it narrows from age-related changes, such as like arthritis, the bones get bigger, and there's that narrowing of that region there. There is a lot of care and adjustments that can be done to help create normal motion of the spine, especially with stenosis. So the short answer is yes. The longer, more complicated answer is it depends on the severity. So I've treated patients with stenosis, gotten them a really good place. Again, not everyone is comparable. I've also treated some patients where we've gotten them to a really good place, such as like in 4 weeks or 8 weeks of care, and we've kind of hit a plateau with our progress that we can get with chiropractic. Now that is a question of, are you okay with the progress here? Do we need to take the next steps and maybe add physical therapy? Or is the next step really, let's get a second opinion with an orthopedist to see if an injection is the right next step for you? So longer answer is, it depends person to person. Short answer is absolutely. Yes, sir.
Are there times where the practice would be going from conservative care to imaging, and then rather than on to interventional care, go back to conservative care?
Absolute great question. So the question was, is it possible to go from conservative care to imaging and instead of going the rest of the way, go back to conservative care? And the answer is absolutely. Absolutely. Oftentimes, imaging is used to find better information of what's going on. Now, any provider that you see is going to use their clinical judgment as well as their exam, feeling the spine, feeling everything to determine what areas need treatment. If for whatever reason the region is wrong, the area that the chiropractor is adjusting or the area that the physical therapist is focusing on is just not doing the trick, we're just getting at the plateau, we get imaging done, and it might provide better clinical information to say, you know what, there's also a disc component here. Let's change our treatment plan and let's change the approach. So oftentimes, actually not often, sometimes imaging is also used to confirm certain diagnosis or to change a certain diagnosis, especially if after 4 to 8 weeks of care, there's a certain plateau where you're not progressing, but you're not regressing either. Does that make sense? Beautiful.
Yeah, that was a great question. The other is everyone heals sometimes at a different rate, and going the imaging route to just kind of confirm that there's nothing else going on, and knowing that it's just taking a little bit longer for you, as long as we're seeing progress. Sometimes we'll use it for that, and then hop back to conservative care.
So it's time related.
A lot of it can be, yes. Again, we'll set up the benchmarks for it and figure out whether or not we're hitting them the way we want to. Thank you.
I have 2 questions. First with the, yep.
When do you use ice and when do you use heat?
Great question. Great question. The question is, when do you use ice? When do you use heat? I'm going to tell you from a research perspective, and then I'm going to tell you from my clinical perspective. Research perspective, there is no difference. Okay? Now, from a research perspective, several studies have been done to show the effectiveness of ice and the effectiveness of heat. The specific difference is, though, that if you use heat, you want to use moist heat. What is moist heat? It can be as simple as taking a really hot shower and doing gentle stretches. It could be soaking a kitchen towel under hot water. Now, please be careful if it is hot to not burn your skin, and placing that hot towel over that region of your back. Moist heat tends to be more effective than just using an electronic heating pad for your back. In terms of ice, traditionally, ice has always been used for I just hurt myself, I need something right now, throw ice on for 10 minutes. The key is 10 minutes. Again, a lot of research has shown that if you do ice for 20 minutes, you stop getting benefits after 10 minutes. But if you want to do 20 minutes, 10 minutes on, take a little break, do another 10 minutes. That's the more research answer. Clinical answer is that it sometimes depends. If it has been a long-standing issue where you've had it for several weeks, several months, or years, and it's more of the stiffness type feeling, I tend to find that heat will work a lot better. Now, if you have sharp shooting pain or more nervy pain, clinically, I have found that sometimes 10 minutes of ice will work better. So use that information as you will. Again, research shows not a significant difference either or, but there's your answer for you. Yes?
Without having a background of an accident
Yep.
or sports-wise or whatever, without having any of that, how much of Medicare covers it?
So the question is, without having any injury, no accident, no fall, no past football player type accident, no previous injury, how much does Medicare cover? And I see Dr. Smith is excited to answer. Go ahead.
I spend a lot of my time with these type of questions. Medicare covers chiropractic. You don't have to have an accident. You don't have to have a fall or an injury. As long as you have some sort of pain and there's some objective finding that quantifies why you're having that pain, Medicare will cover the cost of your care up to a point to when either A, we've solved it, a big win. Or B, we've hit a plateau and we can't get any further. But otherwise, Medicare will cover it. Medicare does not cover the first initial visit, which is the evaluation, but they cover every visit after that with just a 20% copay or co-insurance, which is about $8 if you don't have a secondary insurance that picks it up.
When did that change? It wasn't when I went.
Really?
Physical therapy?
Does Medicare cover that?
Medicare does cover that. There is a
Didn't mine.
there is a cap
Yeah.
associated to it. I forget what that dollar amount is, but they should cover it as long as the referral's in place from your primary care.
I got it from the doctor.
Interesting.
Two questions, one from the back.
I just read in the 2024 Medicare book that I just got like 5 minutes ago, that they're gonna start covering chronic pain, like if you've had it for 3 months or more with, but I don't know if that includes the chiropractor, if it's just discussions, it doesn't really say in there. Have you heard of this?
Yeah. So if you come with chronic pain, in other words, you start in a chiropractic office with chronic pain, having pain in your back for 6, 8, 10 months, you've done other things, and it's still there. And our evaluation shows that it's something that we can attempt to put a treatment plan together to help. It's covered. What Medicare doesn't cover when it comes to chronic pain is if you started, whether it was acute pain such as an injury or chronic, and we went through care, whether it's 4 weeks or 8 weeks or what have you, and then it's, you know what, we're at this level, it's going to be this way. We got it from a solid 7 out of 10, which is bad, down to a 4 to 10, but we're never going to get it down to a 1 out of 10. They will eventually stop covering it. But they will cover chronic pain, they'll cover acute pain, all the way through to the point where we hit a plateau or solid.
Now, is acute pain, like, I had hip replacement almost 2 years ago, and I still have pain when is that considered acute pain? I don't know what is considered what. Pretty healthy all my life, so.
Yeah. I mean, you have more of like what's called a chronic recurring pain, right? So
Yeah, it's never gone away.
Yeah.
The hip is fine, they say, it's,
yeah, it's probably more around
yeah,
towards the
like
butt there.
scar tissue, it's really,
Yeah.
really.
Yeah, so it's acute pain would be classified as you haven't had any pain in that area and all of a sudden something happened to cause you to have this stronger pain. In other words, you have no sort of prior history to it. In your case where you kind of had it and it's been kind of lingering around, it comes and goes, falls a bit more to the chronic recurrent. But either or, they're both covered. They're both significant issues, yeah.
Thank you.
Yep. A question in the front here, and then
Do you always get the script from the primary care doctor, or is it a specialist?
For physical therapy,
Either one.
chiropractic, you don't need a script.
Okay.
Yeah, chiropractic is the only insurance company in Massachusetts that requires a script is Mass Health. Medicare does not. Blue Cross does not. You guys can come to us off the street. For physical therapy, you're generally best to get it from your primary care, but you can get it from either or. You can get it from your orthopedic specialist or your primary care.
Thank you.
Yeah.
thank you. Yes.
My question was, when did that come into, when I was going to the chiropractor, I paid for everything. They didn't cover it. Medicare did not.
Depends, they may not have been a Medicare provider. So that is one of the differences between our group and a lot of other groups is we actually are providers for every
Interesting.
insurance that's out there.
Mm-hmm.
It's kind of the benefits of us being a larger group is that we have the abilities to manage all these bazillion
Yeah.
managed care plans. But yeah, so that's,
Thank you.
that
Yeah.
might have been the difference. Because some are just straight cash. They don't want to deal with any insurance. And I
Right.
got to tell you, I don't blame them. But we have the team in our corporate office to handle it.
They,
Absolutely.
At one point, they were paying for, when you were 60, and I was not, of course. We're paying, but then I didn't have to go anymore, so that's okay.
That's great.
Yeah, yeah.
I saw two hands over here. Yes, ma'am.
Have you had any experience with long haul COVID, pain recovery? You know, that tends to be general body pain. You know, you're into this a couple of years,
Mm-hmm.
so long haulers. Have you ever worked with any long haulers?
Absolutely. I've had a few patients with patients with long-standing effects from COVID, whether it is a chronic cough or most commonly with a like a chronic cough, typically there's a lot of joint dysfunction in the areas of the mid back and the areas of the rib cage. Again, everyone is a little bit different. So if your goals may be, or that person's goal may be, I need to relieve pain because of these issues that I've been working with from, and it doesn't have to be COVID necessarily. It could even be diabetes. It can be other related conditions that eventually affect your musculoskeletal system and the joints of the spine. We can absolutely address that and work towards that with that emphasis of what are your goals in mind and what do we need to do to get you to there. Yeah.
If it manifests as a musculoskeletal issue, and from your history and from our objective findings, it shows that way, then it can be covered, by Medicare, and we can help with it. But specifically treating long, haul COVID as a diagnosis, not necessarily. Almost the secondary effects of it from musculoskeletal standpoint.
Yep.
Is where we would come into play.
Yep. Yes, ma'am.
I was wondering, is there a cure for sciatica? Anything you can do for it? Because that's been doing so many different things.
I'm sorry to hear that.
Helping.
Oh, goodness. So the question was, is there anything that can be done for sciatica? The answer is yes. The short answer is yes. Again, long, complicated answer is it depends. But that's the purpose of the initial examination, is to really evaluate the tissues, to really evaluate, is the sciatica something that we can absolutely change, or is it something that maybe there will be a change, which brings up a really good point. If there is a particular condition where the provider, whether it's me or another chiropractor or a physical therapist, and they're not 100% sure if we can completely eliminate this pain, what they will most often do, myself included, is we'll do a trial of care of 4 weeks, meaning let's work on it. Let's work on that sciatica. Let's work on whatever condition that might be. If we are improving at that 4-week mark, where we'll do another exam to really progress our changes, at that point, if we're seeing a lot of improvement, fantastic. Maybe we continue care. And if it gets to that point where, all right, I've been going to the chiropractor for 4 weeks and nothing has changed, that benchmark moment, that reevaluation moment, is a really good time to have an intentional conversation with whichever provider you're seeing, to say, hey, we've been doing great work visit by visit, but big picture wise, I'm not where I need to be. And in that case, we can give recommendations of what might be the next step for you. Yeah, absolutely.
One doctor gave me this an exercise to do with a rolling pin.
Yep.
Just to roll it.
No, not it. I'm sorry to hear that.
For a little while, but it's not here. It starts like in your, but when it goes down.
Yeah. Yeah. Absolutely. I mean, my recommendation is, let's definitely set something up, have somebody really fully evaluate that and come with a plan. Absolutely. Yeah. Yes, sir.
Is there anything that you could do, like for somebody that has a herniated disc, really? And I had a very sad experience with my mother with a herniated disc, really, where she went along with it, and she had surgery at 81, and she was in perfect condition. She was driving and all that, and the physical therapist begged me and her not to do it.
Yeah.
And they did it,
Yeah.
and it fixed her back perfectly.
Yeah.
And the surgeon said I did a wonderful job. The problem is that she had a blood clot that went to her lung, and then for the next 15 years she was never herself. And so that's why I think surgery does have a negative risk factor too.
Yeah.
But, I mean, is there something that you could do with a herniated disc, or because she had a spinal fusion?
Yeah. So the question is there anything that we can do about disc herniations? Again, the short answer is yes. There's a lot of treatment modalities and treatment approaches for the disc herniation. The way that treatment approaches herniation is to allow for the body to heal itself. So introducing normal motion, what we would be targeting to do is to allow the discs to heal on its own, to reduce that herniation on its own. If you're asking me, is there anything that we do only for that disc? The answer is no, but the purpose of treatment is to help introduce healing to that area of the joint so that disc can heal and so that normal motion of that joint can occur. Again, sometimes it depends on the severity. Sometimes a disc herniation can be so severe that there might not be something that I could do. Those are very rare cases. More often than not, there is something that can be done to help speed the healing process. I'll be right there. To speed the healing process and to help get to that point of recovery.
I would say that what the surgeon did tell me is that because of the issue, my mother would be walking less and exercising less, so then she would quickly deteriorate, so that there'd be a serious risk in not doing it, and so we went ahead and did it, but I didn't.
Yeah, it's tough, but I think that in that case, a combination of physical therapy and chiropractic might have been the best bet for that. Absolutely. Yes, ma'am.
He said she had a fusion. Why would they do a fusion for a herniated disc? I had a herniated disc, it was so huge. He just didn't cut it out, and I was fine.
I wish I could give you an answer. I am not a surgeon, and so, and I say that in the sense of thank you so much for coming. There's several different types of surgeries out there. There are surgeries where they can remove certain parts of the discs, surgeries where they can remove a certain part of the bone, surgeries where they just fuse certain segments so that a re-injury won't occur. That's really based on a surgeon's evaluation and how they see the treatment best. Unfortunately, for some folks it works and for some it doesn't.
One second. I think we're kind of running up to the end of our hour here. If there's any questions anyone has specifically, Dr. Rojas and I'll be here for a few more minutes. You can come up and ask us. I really wanted to thank you for all being such a great, attentive, and audience and having great questions. If you haven't noticed with Dr. Rojas, there's two things you get from her. One is obviously passion for what she does. The other is her honesty. So to me, that's what I look for in a provider. And with that, if there's any questions that we can't get to today, on your sheet there's Dr. Rojas's email address, as well as the office number. She's more than willing to take a phone call. If you email her, she'll probably set up a time to do a quick 10 or 15 minute consultation, which is no charge on the phone, to answer any kind of specific individual questions you have.
Yep.
Other than that, do you have anything to add?
No, thank you so much for your time. Thank you so much for being here. Yes, thank you.